In the bootcamp course, we review the technical details of Chiari surgery along with statistics on outcomes and complications. In this module, we will discuss some of the practical aspects of undergoing and recovering from Chiari surgery. First, we will focus on adults, and then discuss several issues specific to children. While only about half of adult Chiari patients have surgery, for those who do, it is important to realize that it is a big deal, and a little bit of planning before the event can go a long way to make things easier. With that in mind, here are some things to consider before the actual surgery. While it is important to remain optimistic, it is also important to be realistic and consider that any major surgery can involve serious complications and bad outcomes. Therefore, it is important to have your legal affairs in order, including a will, an advance directive, and a medical power of attorney. An advance directive is a document that lays out your wishes regarding medical treatment in situations where you are unable to communicate, and the medical power of attorney names someone who can make medical decisions on your behalf if you are unable to do so. These documents are important legal tools to ensure that all decisions are made by you or your appointee and not the doctor or hospital. It is also important to consider that your physical capabilities are likely to be limited after the surgery, potentially for weeks. Here, a little organization goes a long way. Do as many chores ahead of time as possible, such as paying bills, cleaning the house, etc., and most importantly, arrange for help during your recovery. It pays to hope for the best, but plan for the worst. What help would you need if there were complications and you are sidelined for months, not weeks? Think through worst-case scenarios and have backup plans ready. Next, if you are employed, notify the appropriate people and establish expectations that you will likely be off work for a few weeks. If your benefits include short-term disability, you will need to understand how that works and how to receive it. Think about what you want to take to the hospital. While, as a patient, you should not have anything with you, someone else can bring you things for your hospital stay after surgery, such as slippers, a robe, sweatpants, toiletries, etc. Finally, make sure you understand and follow all of your pre-op instructions, and try your best to get a good night's sleep before you go to the hospital. While planning is the key leading up to the surgery, the most important actions you can take while you're in the hospital are to pay attention and speak up. Unfortunately, medication errors in hospitals are more common than you might think. In fact, it is estimated that there are at least 400,000 medication errors each year, resulting in at least 7,000 deaths. Types of errors include administering the wrong medicine, issuing the wrong dosage, giving medication to the wrong patient, giving doses too close together time-wise, and not identifying conflicts with other medications and health conditions. Medications delivered through an IV have an especially high error rate. It is important that every time you are receiving medication, you ask what it is, what the dosage is, and what it's for. If something doesn't seem right, don't hesitate to speak up. This is where it can be very helpful to have someone with you whose job is to monitor everything and advocate for you if necessary. Beyond medications, if you have any questions or concerns about anything, don't be shy. Don't assume everything is okay. Don't worry about bothering the staff. Ask questions and make sure you understand everything. Hopefully your surgery will be without complications, and after a couple of days in the hospital, you can begin to focus on your recovery. When thinking about recovery, it is important to realize that everyone is different. Some people recover quickly, while for others it can take months or even years. The following quotes from Chiari patients highlight this.
I was home in 5 days and up to the full activities of a mom and mom's taxi within 14. I just did my chores slower.
Recovery was an adventure in and of itself. I had to ask for help in doing the simplest things. I had to rely on everyone to carry me through.
Everything was not wonderful right away. It took 18 months to get all the strength back in my right arm, and I had really annoying myoclonus for several months afterward. I had tinnitus for about 1 year, and I had problems with balance and confused speech for about 3 months.
Many factors can influence how quickly and how well someone recovers, such as their age, whether there were surgical complications, how successful the decompression was, how long they had symptoms before undergoing surgery, whether they have other medical conditions such as diabetes and high blood pressure, their overall level of physical conditioning prior to surgery, and last but certainly not least, their mental health and attitude towards the surgery. During recovery, a difficult decision many patients must make is if and when to return to work. Unfortunately, going back to work is not a realistic option for everyone, and returning to work too soon can be detrimental. A study of 50 adult surgical patients found that only 76% of those employed before surgery returned to work after surgery. For those that did, the median time to get back to the job was 6 weeks, and the range was 4 to 12 weeks. If possible, consider returning to work part-time at first and slowly increasing your hours. Or if your employer permits it, consider working remotely while you recover, then build up to hybrid, and then finally, a full-time return to in-person. Similarly, go very slowly when it comes to using your neck muscles for lifting things, driving, and working on a computer. Remember that these muscles were cut as part of the surgery and need time to heal. Try to take frequent breaks and lie down for short periods of time during the day to rest your neck and let any pressure that has built up in your head to dissipate. Turning our attention to pediatric patients, Conquer Chiari is often asked by parents what to tell their child about a diagnosis or the prospect of surgery. There is no right or wrong answer to this question and depends on their age, maturity, personality, and temperament. Some children may want to know all the details of the surgery, while others may just want to be told that they will feel better when it's over and it won't hurt too badly. The answer really boils down to Parenting 101. Parents know their children and, hopefully, how to communicate with them. Just take your time and let your child work things through in their mind. But most importantly, trust yourself to do what is right for your child. As with adults, it is best to hope for the best, but plan for complications. Proper planning can go a long way during what could become a difficult time. Think about what would be required if your child is in the hospital for more than a few days. Chances are you will be there as much as possible, so try to arrange for who would drive any siblings around, cook meals, etc. Also arrange ahead of time who else can cover during times you can't be there, or when you need a break. Tell your relatives, neighbors, and friends what is going on and ask if they can pitch in if needed. If you're super organized, line up the tasks ahead of time. Pick one person to be in charge of all the helpers and make a chart of responsibilities. Picking one person to be in charge gives everyone else someone to ask questions of without bothering you, and that person knows it is okay to check in with you now and then. Most of all, rely on your support system. Whether it's family that lives nearby, good friends, or neighbors, a strong support system can make a world of difference. With a strong support system at home, parents can turn their full attention to their child's hospital experience. Research has shown that nurses can have a significant positive impact on the experience of the entire family during a pediatric hospital stay. Nurses can help explain what is going on, they can provide comfort to the child during times when parents are not allowed to be there, and they can solve problems. Most nurses are nurturing and compassionate and can be a valuable resource for parents. It is in your best interest to develop and utilize this resource. Ask questions, find out how you can help and develop a rapport with the nursing staff. Lean on them for emotional support, and don't be afraid to ask for help. After surgery, children tend to recover more quickly than adults. In fact, a large report found that on average, children return to school within 12 days of surgery. As a parent, just make sure to understand any instructions from the surgeon regarding restrictions on physical activities and what to watch for in terms of complications. For both adults and children, Chiari surgery is a significant event, but with proper planning and a positive outlook, the experience can be navigated a little more easily.